Stress ulcers, causes and symptoms. A stress ulcer causes sores in the upper gastrointestinal tract. This sores damage the gastrointestinal lining and cause pain and a feeling of burning, as well as an increased risk of infection. The damage ranges from minor irritation to severe bleeding. Ulcers are common among people under immense physical stress, such as those in intensive care units. Doctors sometimes call stress ulcers stress related mucosal damage. The primary goal of treatment is to reduce stomach acid and lower the risk of serious infection, bleeding, and shock. Causes. A stress ulcer is not the same as a peptic ulcer that is made worse by stress. While both cause sores in the lining of the stomach and the intestines, a typical peptic ulcer, sometimes called a stomach ulcer, tends to emerge gradually as drugs or infections weaken the gastrointestinal lining. Stress ulcers come on suddenly, usually as a result of psychological stress. Some acidic foods can make ulcers worse, as can physical stress such as the stress of a serious injury or infection. This may be because stress increases stomach acid. Stress ulcers can be life-threatening because they tend to affect very sick people, while stomach ulcers that are made worse by stress are rarely serious. The stomach naturally produces acid to help digest food. When the stomach's acidic environment changes or becomes too acidic, a person may develop symptoms of an ulcer. In people under severe psychological stress, ulcers may result from changes in the body's potential of hydrogen. A Helicobacter pylori or H. pylori infection increases the risk of all ulcers, including stress ulcers. Rarely very significant psychological stress can trigger a stress ulcer. For example, a 2018 case report details the treatment of an ulcer in a toddler. The ulcer appeared after she had refused to go to daycare for 1 month. The doctors speculate that stress probably caused the ulcer. Certain health and lifestyle factors increase the risk of damage to the stomach and intestinal lining. These factors make it more likely that a person will develop an ulcer, including a stress-related ulcer. H. pylori infection, use of non-steroidal anti-inflammatory drugs such as ibuprofen. In people facing serious injuries or health emergencies, a history of ulcers may also increase the risk of a stress ulcer. Symptoms. Stress ulcers cause a continuum of symptoms. Minor ulcers may cause no symptoms at all, while severe ulcers may cause intense pain and serious complications. Because people with stress ulcers are already sick, it can be difficult to distinguish ulcer symptoms from symptoms of another illnesses. Symptoms of a stress ulcer include pain in the upper stomach, pain that gets better or worse with food, feeling bloated or unusually full, nausea or vomiting, symptoms of anemia such as shortness of breath and pale skin. Some ulcers bleed a lot, causing dangerous blood loss. In people who are already fighting serious injuries, this blood loss can be life-threatening. Symptoms of a rapidly bleeding ulcer include red vomit or vomit that resembles coffee grounds, red or maroon bowel movements, very dark teary bowel movements, feeling lightheaded or fainting. Prevention. Stress ulcers are very common in emergency and intensive care settings. Over 75% of people hospitalized with severe burns or head trauma develops stress ulcers within 72 hours of the injury. So some hospitals give patients medications to prevent ulcers and routinely check for them. Strategies for preventing stress ulcers are similar to those for treating the ulcers. A Cleveland Clinic Journal of Medicine review cautions that there is no reason to give all hospitalized patients preventive treatment. Unnecessary preventive treatment increases cost and complications. The American Society of Health System Pharmacists recommend preventive treatment for patients who meet any of the following criteria: use of blood thinners, use of a ventilator for more than 48 hours, an ulcer in the past year, bleeding in the gastrointestinal tract in the past year, systemic infection or sepsis, a stay in the intensive care unit lasting longer than 1 week, gastrointestinal bleeding for 6 days or longer, taking more than 250 milligrams of hydrocortisone for per day. In the past, doctors told people with a history of ulcers to eat a bland diet. New research shows that this is not necessary. Spicy foods do not cause ulcers, though some people notice that their symptoms get worse after eating certain foods.